Hello guys, so now we shall be discussing regarding the pancreas. Okay, so all of you know that pancreas is a mixed gland. Why it is called as a mixed gland? Because it has got both exocrine glands as well as the endocrine activity, right? Because of both the exocrine activity as well as the endocrine activity, you call it as a mixed gland. And what are the exocrine? Exocrine in the sense the hormones are released, right? The enzymes are released or the chemicals are released into the ducts. That is what is called as exocrine. If they are directly released into the blood, you call it as an endocrine activity. Okay, so both the activities are located within the pancreas, so that is why you can call it as a mixed endocrine gland. Next important thing is that mostly in patients who are heavy alcoholics, right, who does binge drinking in the sense heavy amount of alcohol at a single time, right? So in those patients, and not only that, even in the patients who are having a history of gallstones, all of you know gallstones, gallbladder stones, right? So in those patients also, these are the two main important risk factors for the patients to develop acute pancreatitis, that is infection to the pancreas. So infection to the pancreas is called as acute pancreatitis. So either whenever a patient of acute pancreatitis is coming to you, either of two complaints will be there, or not complaints, the history will be there. First important thing is maybe patient will complain that he is acute alcoholic, or second important thing is he will complain that he might be having these stones. So either of these two things will be there definitely in a history of a patient with acute pancreatitis. Okay, right. Now in this acute pancreatitis, first important thing is, see, this is the duodenum over here. All of you know that the pancreas is located in the loop of the duodenum. Okay, so this is the duodenum. The pancreas is located in the loop of the duodenum. So exactly here you have got your pancreas. This is the head of the pancreas. And this is the tail of the pancreas, right? So this entire thing over here which I have drawn right now, right, this entire thing over here which I have drawn right now is your pancreas. Now in this pancreas there are different parts. For example, this part of the pancreas is called as the head of the pancreas. Okay, this is called as the head of the pancreas. And after that, this part of the pancreas which you have is called as the neck of the pancreas. Head of the pancreas, and this is called as the neck of the pancreas. And after that, this part of the pancreas which you have is called as the body of the pancreas. Okay, so this part is called as the body of the pancreas. And finally you have got what is called as the tail of the pancreas. So this is called as the tail of the pancreas. Okay, so many different structures of the pancreas we have got over here. So this part is called as the head of the pancreas, this is called as the neck of the pancreas, this is called as the body of the pancreas, and this is called as the tail of the pancreas. Okay, and next important thing is that this pancreas, the head is mainly containing a process which you can see here, right? So this is called as uncinate process. This is called as what? Uncinate process of pancreas. What is this process? Uncinate process of pancreas. Now, important thing you need to know is that where is the tail projecting into? So all of you know that here we have got our spleen. So tail is, and the center part of the spleen is called as hilum of the spleen, and the tail is projecting towards the hilum of the spleen. Okay, remember that thing, that the tail is projecting towards the hilum of the spleen. So if I take the upper border, which means this one, this is called as the upper border of the pancreas, and if I take the lower border of the pancreas, the uncinate process, this is the lower border of the pancreas. So pancreas, if you look, topography of the pancreas, this topography of the pancreas is that it is ranging all the way from T12 vertebra all the way till L3 vertebra. Okay, so all the way from T12 till L3 you have got your pancreas. Now behind the pancreas there are two important vessels which you need to know. What are those two important vessels? So I'll draw those vessels and you'll answer me. Okay, so this is one large vessel that is located behind the pancreas. So this is one vessel that is located behind the pancreas. So I hope you might guess the vessel by now. What is the name of this vessel, guys? So this is called as your inferior vena cava. Okay, so this vessel over here is called as your inferior vena cava. Now after this inferior vena cava, the next important vessel that is located just side to it, what is this called as? Yes, what is this vessel which is located just side to that inferior vena cava is called? This is called as a aorta. Okay, so this structure which I am drawing here right now is called as your aorta. So this is your aorta. So there are two important vessels that are located here. What are those two important vessels? One is called as your inferior vena cava, another one is called as your aorta. Okay, these are the two important structures.